What if I told you that one of the most powerful tools for supporting your blood sugar isn't in a stronger prescription, not in a new supplement, not in another restrictive diet, but in how you prepare and drink something as simple as green tea? I know that sounds almost too basic. You've probably heard about green tea for years. You may even drink it already. It's labeled healthy. It's praised in magazines. It's linked to heart health, metabolism, and longevity. So you might be thinking, Doctor, I already drink green tea. If it worked, wouldn't my numbers be better by now? That's a fair question. And if you've been managing type 2 diabetes or pre-diabetes for years, you've probably tried many things. You've adjusted your portions, you've switched to whole grains, you've cut sugar, you take your medication faithfully, you check your fasting numbers, you track your A1C, and still, your readings surprise you. One morning, it's 132, the next, it's 167, same dinner, same routine, same medication. The unpredictability is exhausting. In my practice, I see this frustration every week. Men and women in their 60s and 70s doing everything right and still feeling like they're losing ground. They feel disciplined, they feel committed, but they don't feel in control. And when you don't feel in control of your blood sugar, it affects everything: your energy, your confidence, even your sleep. So before we go any further, I want to know something. Where are you watching from, and how old are you? Drop your country and your age in the comments below. It reminds us that blood sugar management isn't just your struggle, it's global, and we're in this together. Now here's what most people don't realize. Green tea does contain powerful natural compounds that can support insulin sensitivity and reduce inflammation, but the way most people drink it makes those compounds far less effective than they could be. It's not about drinking more tea. It's not about replacing your medication. It's about timing, preparation, and consistency. Small adjustments, strategic adjustments. And when those adjustments are done correctly, I've seen measurable improvements in fasting glucose stability, reduced post-meal spikes, and steadier daily energy without changing medication doses. But there's a reason most people never see those results. It has nothing to do with effort. It has everything to do with understanding what's actually happening inside your body after 50, after 60, when insulin works differently than it did decades ago. In the next section, I'm going to explain exactly what changes in your metabolism with age and why that makes the way you drink green tea far more important than you think. Before we talk about green tea strategy, you need to understand something very important. After 50, and especially after 60, your body does not process glucose the way it used to. Even if your diet hasn't changed, even if your weight hasn't changed, even if your effort hasn't changed, three major shifts begin to happen quietly. First, your cells become less responsive to insulin. Insulin's job is simple: move glucose from your bloodstream into your cells so it can be used for energy. But over time, your cells don't respond as quickly. It's like insulin knocks on the door, and the door opens slower than it used to. When that happens, glucose stays in the bloodstream longer. Numbers rise, and you feel like you're doing something wrong, even when you're not. Second, your liver becomes more active overnight. While you sleep, your body naturally releases stored glucose to prepare you for the morning. But as we age, this release can become exaggerated. That's one reason so many people wake up with higher fasting readings, even after eating carefully the night before. You didn't eat sugar at midnight. Your liver released it. Third, and this is the one almost nobody talks about, inflammation increases with age. Not the kind of inflammation that causes obvious swelling. I'm talking about low-grade internal inflammation, the kind that stiffens blood vessels, interferes with insulin signaling, and makes glucose control less predictable. Now here's where green tea enters the conversation. Green tea contains natural compounds that may help improve how your cells respond to insulin. It may help reduce internal inflammation. It may help support healthier blood vessel function. But there's a problem. Those compounds are delicate. They are sensitive to heat, sensitive to timing, sensitive to digestion, and if they are not absorbed properly, they never reach your bloodstream in meaningful amounts. So you may be drinking green tea faithfully, every day, believing it's helping your diabetes. But if it's brewed too hot, drunk at the wrong time, consumed without supporting absorption, you may be getting only a fraction of its potential benefit. That's not a criticism. That's biology. And once you understand that, you realize something powerful. This isn't about adding something new to your life. It's about refining something you may already be doing. Let me tell you about James. James is 69 years old. He's disciplined, walks every morning, eats oatmeal for breakfast, avoids desserts, takes his metformin exactly as prescribed, and for the past 4 years, he's been drinking 2 cups of green tea every single day. He believed he was giving himself an advantage. When he came into my office, he placed his glucose log on my desk. His fasting readings were scattered. One morning, 134, another morning, 171, then 148, then 163. Same dinner, same portion, same medication, same bedtime. His frustration wasn't anger, it was confusion. "Doctor, I don't understand," he said. "I'm even drinking green tea. Isn't that supposed to help?" That question stopped me. Because James wasn't lazy. He wasn't careless. He wasn't ignoring advice. He was doing what most health articles recommend. So I asked him something simple. "How are you preparing it?" He boiled water aggressively until it was bubbling hard, poured it over a tea bag, let it sit while he showered, sometimes 8 or 9 minutes. Then he drank it with his breakfast and coffee. Every day. Here's what he didn't know. Boiling water that's too hot can degrade some of green tea's most sensitive compounds. Letting it steep too long can change its chemical balance. Drinking it alongside caffeine from coffee can alter absorption. Consuming it directly with carbohydrates can blunt part of its metabolic support effect. None of those mistakes were dramatic, but together, they reduced its impact. James thought he was taking advantage of green tea, but biologically, he wasn't giving his body the right conditions to use it properly, and this is where most people fall into the same pattern. They adopt a healthy habit, but they never optimize it. Green tea is not magic, it's chemistry, and chemistry follows rules. When you ignore the rules, results shrink. When you respect them, results compound. After we adjusted 3 small things for James, temperature, timing, and pairing, something interesting happened. Within 2 weeks, his morning readings became more stable. Not perfect, not dramatic, but predictable. Predictable numbers reduce stress, and lower stress improves blood sugar further. That's a cycle most people underestimate. Before I show you how to use green tea correctly, we need to talk about the 3 mistakes that quietly cancel its benefits for many adults over 60. These mistakes are common, they're understandable, and almost everyone makes at least one of them without realizing it. Mistake number 1 is brewing green tea too hot and for too long. Green tea is delicate. It's not like black tea or coffee. When water is aggressively boiling and poured directly over the leaves, some of the most helpful compounds begin to break down immediately. Letting it steep for 8, 10, or even 15 minutes doesn't make it stronger in a helpful way. It often just makes it more bitter and less effective. Many people assume stronger equals better. With green tea, that's often not true. Mistake number 2 is drinking green tea at the wrong time of day. I see people drink it first thing in the morning on an empty stomach, alongside coffee, or late at night after dinner. Each of those choices can reduce its usefulness. Early morning, your body is already releasing stress hormones and glucose. Stacking caffeine and tea compounds at that moment can make blood sugar less predictable for some people. Late at night, even small amounts of caffeine can disrupt sleep, and poor sleep raises blood sugar the next day. Timing matters more than most people think. Mistake number 3 is drinking green tea alone without supporting absorption. This is the most overlooked issue. The helpful compounds in green tea are fragile. As they move through your digestive system, they can be broken down before they ever reach your bloodstream. Without simple natural supports, much of what you drink never gets a chance to help your cells respond better to insulin. Think of it like taking a package to the wrong address. The package exists, the delivery fails. And here's why these mistakes matter so much after 60. As we age, digestion slows slightly. Stomach conditions change. Nutrient absorption becomes less efficient. So even small preparation errors that wouldn't matter much at 30 or 40 can have a bigger impact later in life. That's why some people say, green tea worked for me years ago, but not anymore. It may not be the tea, it may be the way the body now handles it. The good news is this: you don't need to stop drinking green tea. You don't need to switch brands. You don't need expensive supplements. You just need a simple structure that respects how your body works now. In the next section, I'm going to introduce the exact framework I use with my patients. It's easy to follow, practical in real life, and designed specifically for adults managing blood sugar challenges. Once you understand this structure, green tea stops being a casual habit and starts becoming a supportive tool. Stay with me. The structure is where the real change begins. Now let's put structure around this. Because information without structure leads to inconsistency, and inconsistency leads to unpredictable numbers. The framework I use with my patients is simple. I call it the G3 method. G stands for green tea. The first 3 represents 3 timing points. The second 3 represents 3 preparation elements. Nothing extreme, nothing complicated, just strategic alignment. Let's start with the first 3. The timing points. Timing point number 1. Mid-morning, not immediately upon waking. When you wake up, your cortisol levels are naturally elevated. Your liver is already releasing glucose into your bloodstream. This is normal. It's part of the body's design. Drinking green tea immediately upon waking, especially alongside coffee, can stack stimulation on top of an already elevated system. Instead, hydrate first with plain water. Give your body 30 to 60 minutes to stabilize. Then drink your first properly prepared cup mid-morning. This supports insulin sensitivity before your next meal without amplifying early morning glucose release. Timing. Point number 2, 20 to 30 minutes before your largest carbohydrate meal. This is where many patients see noticeable improvement. When green tea is consumed before a carb-heavy meal, it helps prepare your metabolic system. It supports smoother glucose handling instead of reacting after a spike occurs. Not during the meal, not after the meal, before. That difference matters. Timing. Point number 3, early afternoon, not evening. Even though green tea contains less caffeine than coffee, it still contains caffeine. Drinking it late in the day can interfere with sleep quality, and poor sleep increases insulin resistance the following morning. Your final cup, if you choose to have one, should be no later than mid-afternoon. Now, let's move to the second 3, the preparation elements. Element number 1, temperature. Water should be hot, but not aggressively boiling. After boiling, let it sit briefly before pouring. This protects delicate compounds that support metabolic health. Element number 2, fresh lemon. A squeeze of fresh lemon adds vitamin C, which helps stabilize green tea's active compounds during digestion. This increases the chance they reach your bloodstream intact. Element number 3, a small pinch of freshly ground black pepper. This surprises many people. Black pepper contains a natural compound that may enhance absorption of certain plant compounds. Just a small pinch, not enough to dominate taste, can make a measurable difference in utilization. These are small refinements, but small refinements compound. Green tea does not need to be eliminated. It needs to be aligned. Now that you understand the G3 method, let's make it practical. Because the most common mistake after learning a method like this is overdoing it. More is not better. With green tea, strategy matters more than volume. For most adults over 60 managing blood sugar, 2 cups per day is sufficient. 3 cups can be appropriate for some, but rarely more than that. Excess intake can irritate the stomach, interfere with iron absorption, or disrupt sleep if consumed too late. So here's a simple daily structure. Morning. Wake up and drink plain water first. Allow 30 to 60 minutes before your first green tea. Mid-morning. First cup prepared correctly. Hot but not boiling water, steeped 3 to 4 minutes. Fresh lemon, small pinch of freshly ground black pepper. Pre-meal. Second cup, 20 to 30 minutes before your largest carbohydrate meal of the day. Same preparation method. Optional. Third cup, Early afternoon only before 3 p.m. using the same preparation guidelines. That's it. No extreme changes. No complicated routines. Now let's talk about expectations. Because if you expect dramatic overnight drops in blood sugar, you'll likely be disappointed, and you may quit too early. Here's what I typically see. Week 1. Stabilization begins. You may not see large reductions in fasting glucose immediately. What you may notice instead is less dramatic variability. Post-meal spikes may feel slightly more controlled. Energy may feel steadier in the afternoon. Week 2. Measurable shifts. Some patients begin to see fasting readings trend 8 to 15 points lower on average, not every single day, but enough to notice a pattern, and patterns matter more than single readings. Week 3 to 4. Consistency improves. By the 3rd or 4th week, many patients observe that their average readings, not isolated numbers, are more predictable. Post-meal spikes may be reduced by 10 to 20 points compared to previous weeks. The key word is consistency, not perfection. And here's something important. Track your readings calmly. Don't obsess over one number. Write down fasting glucose and one post-meal reading per day for 2 weeks. Then look at averages. Are the swings smaller? Are mornings slightly steadier? Is energy more stable? If the answer is yes, continue. If you feel jittery, shift your tea earlier. If you experience stomach discomfort, reduce the amount slightly. Adjust intelligently. We're going to talk about safety. Who should be cautious, when to speak to your doctor, and how to integrate this method responsibly with medication. Because responsible strategy is always better than aggressive experimentation. Before we go any further, I need to say something clearly. Green tea is a supportive tool. It is not a replacement for medical treatment. If you are taking metformin, insulin, or any other diabetes medication, you do not stop. You do not reduce dosage on your own. You do not experiment recklessly. What this method does is support how your body responds to insulin. It may improve sensitivity, it may reduce inflammation, it may help smooth post-meal spikes, but medication decisions always belong between you and your physician. Now let's talk about who needs to be cautious. If you are on blood thinners, especially medications that affect clotting, speak with your doctor before significantly increasing green tea intake. Green tea contains natural compounds that may influence clotting pathways. If you have kidney disease, advanced liver disease, or stomach ulcers, individualized guidance is important. Large quantities of green tea can irritate the stomach lining in sensitive individuals. If you are highly sensitive to caffeine, even moderate amounts may disrupt sleep. And remember, poor sleep raises insulin resistance the next day, so if your sleep worsens, your blood sugar may worsen. This is why timing matters. Now here's something equally important. Green tea is not a cure. It will not erase years of metabolic change. It will not reverse diabetes in 2 weeks. Anyone who promises that is not being responsible. What it can do, when used strategically, is support your body's existing systems. It can help insulin work more efficiently. It can reduce inflammatory stress. It can contribute to more stable patterns, and stable patterns reduce anxiety. Let me tell you about Helen. Helen is 73. She had managed diabetes for 18 years. Her A1C had slowly crept upward from 7.2 to 8.1 over 2 years. Her diet was careful. Her medications were consistent. She felt discouraged. When we introduced the G3 method, we made no other changes. No medication adjustments, no new supplements. 4 weeks later, her fasting numbers averaged 12 points lower than before. Her post-meal spikes were consistently smaller. 3 months later, her A1C had moved down to 7.5. Not dramatic, but meaningful. And here's what she told me that mattered more than the lab result. I don't feel like I'm losing control anymore. That emotional shift matters because when patients feel progress, they stay consistent with walking, meals, sleep, and monitoring. The method reinforces discipline instead of replacing it, and that's the key. Green tea does not replace responsibility. It strengthens it. Now we move from information to action. Because understanding a method does nothing unless you apply it. I want you to try something very specific for the next 14 days. Not casually, not occasionally, strategically. For 2 full weeks, follow the G3 method exactly as outlined. Wake up and hydrate first with plain water. Wait 30 to 60 minutes. Prepare your first cup properly, hot, but not aggressively boiling water, steeped 3 to 4 minutes. Fresh lemon, small pinch of freshly ground black pepper. Drink it mid-morning. Then, 20 to 30 minutes before your largest carbohydrate meal of the day, prepare and drink your second cup the same way. Optional third cup, only early afternoon. No late-night tea. No rushed preparation. No random timing. Now here's the critical part. Track intelligently. Every day for 14 days, record your fasting glucose. 1 post-meal reading, preferably after your largest meal. And 1 note about energy level. That's it. Do not change your medication. Do not change your diet dramatically. Do not introduce 5 other supplements at the same time. We want to isolate variables. After 14 days, look at averages. Are your fasting readings slightly more stable? Are post-meal spikes slightly smaller? Is your afternoon energy more consistent? You are not looking for perfection. You are looking for pattern improvement. And here's something important I've observed. When people commit to a structured challenge, something shifts psychologically. They stop feeling reactive. They start feeling proactive. Instead of fearing their glucose meter, they begin studying it. Instead of feeling punished by numbers, they begin interpreting patterns. That mental shift alone reduces stress, and stress directly impacts blood sugar. If after 14 days you see no meaningful change, that's data. If you see improvement, continue for 30 days. If after 30 days your averages are trending downward and your energy is better, discuss those patterns with your physician before making any medication adjustments. Let the data guide you. Now I want to ask you something. Are you willing to try this for 14 days exactly as described? If you are, type 14 days in the comments, because commitment changes outcomes. There is one more layer to this that most people never consider, and it often determines whether green tea becomes helpful or stays neutral. It's not about the tea, it's not about the lemon, it's not even about the black pepper. It's about your overall metabolic environment. Let me explain. Green tea supports insulin sensitivity and reduces inflammatory stress. But if your sleep is consistently poor, if your stress levels are chronically high, or if you're severely dehydrated, the benefits of green tea can be muted. Think of it like this. You can plant healthy seeds in soil. But if the soil is dry, compacted, and neglected, those seeds won't thrive. Your body is the soil. After 60, sleep quality becomes one of the most powerful regulators of blood sugar. Even one night of poor sleep can increase insulin resistance the following day. Cortisol rises, the liver releases more glucose. Fasting readings climb. So if you're drinking green tea late in the afternoon and disrupting sleep without realizing it, you may be canceling its benefit the next morning. Hydration also matters. Even mild dehydration, just slightly below optimal, can raise blood sugar by 10 to 15 points. When blood becomes slightly thicker, glucose circulation slows, and insulin has a harder time working efficiently. That's why I always emphasize water first in the morning before green tea. Now, let's talk about stress. Chronic emotional stress raises cortisol. Elevated cortisol signals the liver to release stored glucose. This happens whether you eat sugar or not. If you are constantly worried about your readings, ironically, that stress may worsen them. This is why structure matters. When you follow a plan like the G3 method, you reduce uncertainty. You introduce predictability, and predictability reduces stress. Green tea works best in a supportive environment. Good hydration, consistent sleep, moderate stress, steady routine. When these elements align, the impact compounds. And here's the advanced insight most people miss. Green tea should not be viewed as a standalone solution. It is a metabolic amplifier. If your habits are aligned, it amplifies stability. If your habits are chaotic, it amplifies very little. This is not discouraging. It's empowering because you control those variables. You control sleep timing. You control hydration. You control when you drink tea, and small aligned decisions compound over weeks. We're going to address common questions I hear from patients, including how this affects A1C, whether prediabetes responds differently, and how long you should realistically continue the method. Stay with me. The clarity will help you avoid unrealistic expectations. At this point, most people have the same 3 questions, and if you're thinking them right now, you're not alone. The first question is always this: will this lower my A1C? The honest answer is possibly, but gradually. A1C reflects your average blood sugar over approximately 3 months. It does not respond to one good week. It does not drop dramatically in 2 weeks. It reflects patterns. If the G3 method improves your daily averages, even by 10 to 15 points consistently, over time, that can influence your A1C. But you won't see that in 7 days. You may see it in 8 to 12 weeks. Patience is part of the process. The second question I hear: what if I have prediabetes instead of full diabetes? In many cases, people with prediabetes respond even more noticeably to small metabolic improvements. When insulin resistance is present but not yet severe, supporting sensitivity through hydration, timing, and green tea strategy may help stabilize early patterns. But again, this is support, not cure. If your fasting glucose is 108 or 115 and trending upward, this method may help slow progression when combined with walking, portion control, and sleep improvement. The third question: how long should I continue? My answer is simple. If after 30 days your numbers are more stable, your energy is steadier, and you feel better, continue. There is no need to cycle off green tea unless you experience stomach irritation or sleep disturbance. 2 properly prepared cups daily is sustainable for most adults. Now let me address something important. Some people ask, what if I don't like lemon or black pepper? You don't have to use both. Lemon alone supports stability of the tea compounds. Black pepper may enhance absorption,